to Medica Nova Wellness Studio. I'm Dr. Angelika Maria Koch with the educational videos about optimal health and the most innovative and holistic approach to your well-being. So finally I've moved to my new location. I'm still experimenting which spot in the house is the right place to make the video, but it will work for now. In this week's video, let's take a look at how you can heal bronchitis with natural and effective therapeutic tools. Bronchitis is one of the top 10 conditions for which people seek medical care. It is an uncomfortable ailment, leaving you coughing for weeks and months, and it comes with a lot of mucus. Although physicians treat bronchitis with antibiotics, the majority of cases are actually caused by viruses, meaning the treatments are not effective. In this video, I will share with you useful guidelines how to meet this situation in a more holistic way. So enjoy this video. To stay updated with my ongoing videos, I encourage you to subscribe to my channel, share and like it with your friends and families, and don't forget to click that bell as it notifies you every time I upload a new video. Now, to boost the algorithm of the YouTube, which helps me marketing my videos to other channels as well, your thumbs ups and likes are so appreciated. And lastly, don't forget to have a look at my website medicanova.net at the online academy, where you will find comprehensive certified university standard home study online courses in integrated medicine and health and wellness coaching. So what is bronchitis? It's an inflammation of the bronchial tubes and the tubes that carry the air to the lungs. And this condition causes you this persistent cough and sometimes also makes it hard to breathe. The coughing may even lead to chest pain or wheezing, especially if you're asthmatic. Bronchitis is also known as a chest cold because it usually occurs after you have experienced a common cold or flu. So the same viruses that give you the cold or the flu also cause bronchitis. Sometimes bacteria are involved too, but 85 to 95% it's caused by viruses, maybe rhinovirus, adenovirus, influenza A, B, or parainfluenza. If bacteria are involved, that means there are other health conditions present, but in both cases your body tries to fight off these germs, and as a result your bronchial tubes start to swell and therefore produce more mucus, which causes smaller openings for the air to flow and makes it therefore harder to breathe. So the main symptoms of your acute bronchitis is this persistent cough. The cough lasts until your bronchial tubes start to heal and the swelling goes down. It can last from 3 weeks to a month, but sometimes it goes longer. But because it's also in adjunct, sort of connected with the cold and the flu, there can be other symptoms involved. Maybe sore throat, fatigue, stuffy or runny nose, fever, the body aches, the common cold and flu symptoms, maybe vomiting. Others experience diarrhea. Usually there is a clear mucus or a slimy substance involved, but if the mucus is yellow and green, it means you have a bacterial infection. As I said, there can be wheezing, chest tightness and pain, and definitely shortness of breath, especially with activity. So we have acute bronchitis and we have the chronic bronchitis. And acute means it's short term. It has a beginning, it has an end, and it will heal itself. Whereas with the chronic situation, it's ongoing and you absolutely are required treatments. So the acute bronchitis is more common. It typically doesn't cause any problems once the infection is gone. As I said, the same viruses that cause the colds and the flu are most common causes of the acute bronchitis as well. It can last from 10 days, a little bit, maybe a few weeks, but that's about it. Whereas in the chronic bronchitis, which is now ongoing, it's much more of a serious condition because it's associated with an accelerated decline of your lung function. It occurs if the lining of the bronchial tubes is constantly irritated and inflamed. And people with chronic bronchitis have long-term cough with mucus. There can be sometimes a bacterial infection on top of it, and so it just makes the existing condition even worse, especially if you're a smoker, right? Then you have this sort of bronchial cough. Smoking is definitely part of chronic bronchitis. Other factors, of course, can be contact with dust, chemical fumes, vapors from certain jobs. They all increase the risk to get bronchitis, and this includes, of course, environmental circumstances and job like coal mining, people who handle grains or livestock farming or who are involved with textile manufacturing. All of that can, sort of instigate bronchitis, or others have very strong sensitivities to allergies or food intolerances, and that can even cause the coughing. So the conventional treatments would be that you will get bronchodilators, which is usually given in asthma or COPD, allergic reactions or any condition which has to do with breathing problems. And it is used for more severe cases, of bronchitis in people who show evidence also of bronchospasm, where sort of the muscles can't relax by themselves. But it does come with its side effects, right? Sometimes people have headaches, nausea, the whole digestive system gets affected, they have upset stomachs and flu-like symptoms on top of it. So it just makes it more complicated. So if you're interested in a health consultation, either for yourself and or your children, contact me at Medica Nova at health@medicanova.net. Medica Nova is my practice for integrated and educational medicine. We offer a unique blend of natural and cutting-edge therapeutic tools from homeopathy, iridology, sclerology, systemic herbology, advanced biofeedback, and health and wellness coaching, and so much more. So book your appointment today. Let's move to the second part of the video called Food for Thought or Metaphysical Meaning. Especially with the ailment of bronchitis, there's a story involved, and often a mental, emotional, upset, feeling, which causes you to sort of cough, and you want to cough something out, right, which you can't resolve in your daily life. And I had bronchitis as a young child twice. And it occurred when my parents divorced, and I couldn't deal with the onslaught of negativity in the house. And I had bronchitis for about 6 months, and I had to, stop school. I had to study from my bed, and it was just a horrible situation. And when I share with you now Jacques Martel's references about bronchitis, you will see it really rings a bell here and definitely resonated in my heart when I read it, because I could really understand why I had bronchitis at that time and for so long, right? Because the mental and emotional aspects weren't really healed. So according to Jacques Martel, bronchitis, or any sort of a physical ailment which ends in the last part of the name, the label itis, means anger. It's inflammatory condition, and it's characterized by an inflammation of the mucous membrane of the bronchi, the tubes conducting air from the trachea to the lungs. It is a disease essentially related to respiration, the act of taking in life and air with desire and enjoyment, so that means inspiration, and then ejecting them temporarily with detachment, means expiration. You let the air out. Inflammation means I'm feeling anger, frustration, or rage even over repressed emotions. Words I need to express and release, maybe about a stifling situation where I feel harassed, a conflict marked by aggressiveness and criticism. Maybe there's an upheaval in the family. There are quarrels. Certainly wasn't mine. It is often a family atmosphere that is charged with tension, silences, and even lies. My freedom is being curtailed. I lack time for myself. I can't catch my breath and breathe. I no longer trust the others. I want to be close to the people I love, but at the same time I'm suffocating which makes me experience great inner heartbreak. There's an inner turmoil, a disruption that prevents me from manifesting my true being and getting proper respect for my rights. I try to communicate with the people closest to me, but I can't achieve a certain inner peace. It is as though life were making me exist exclusively, cut off from one person, who is usually my mother. The family situation is too difficult. I then feel a certain discouragement with life, and I stop struggling to pursue my way. I have little joy in living, and I feel a deep lassitude and inner dissatisfaction. I want to be independent, but I feel great insecurity. What are my own limits? A cough indicating that, I want to be free. I want to free myself by rejecting something or someone that bothers me and makes me angry. And if I'm a child, I may feel insecure or anxious about what is going on in the family. I may feel very sharply my parents' sorrow or their repressed anger. And I have the impression that I must bear that all, being too young to differentiate myself and detach myself from what is going on. I feel I'm under the hold of my parents, living in an emotional prison. Does that ring a bell? It certainly did with me. It certainly explained why I suffered from bronchitis as a child for so long. So what would be the positive affirmation? Well, if I don't want to suffer from chronic bronchitis, for example, I must change my way of seeing life, my attitude. I was born in a family where each member is going through an experience similar to my own. Right? I'm not the only one here. My parents, my brothers and my sisters are all learning too, as well as they can manage. I therefore accept to start seeing joy and love in myself and in each experience in my life. I accept that my personal happiness is my own responsibility, and I stop believing that others will make me happy. Making my own decisions and breathing on my own, such is the first step towards my independence. Yeah? Just give you some food for thought here. So if you want to explore more about yourself, your wellness vision, what motivates you, and how to apply your strengths qualities in achieving the very best of you, then contact Medica Nova Wellness Coaching at health@medicanova.net for your 3 months coaching program. I'm coaching you to be well. Let's move on to the natural treatment protocols. Well, first I would say lifestyle changes are in order here. Anti-inflammatory diet, probiotic-rich diet will help you to really ease off the chronic bronchitis healing path. Anytime you're trying to fight an infection, whether it is viral or bacterial, you should focus on eating an anti-inflammatory diet. It helps to strengthen your immune system and reduces, of course, the internal swelling. Therefore, eat plenty of raw fruits. Great vegetables are important because they're rich in vitamins and minerals, as well as probiotic-rich food. You want to bring in maybe kefir, you've heard about it, cultured vegetables like sauerkraut or kimchi or kombucha, coconut kefir, or even cultured yogurt. Drink plenty of water, stay hydrated to move this phlegm out of your body. Use a humidifier if you need to, because it loosens the mucus and releases the wheezing. Also, just makes you feel a little bit easier. And of course, if you're a smoker, hey, that has to go 100%, right? And also, even try to avoid secondhand smoking, right? Or other lung irritants such as dust, vapors, fumes, and air pollution. Supplements. I think it's very vital to bring in some natural supplements which help you to loosen up the phlegm and open up the airway passages. And one is called N-acetylcysteine. It's called NAC, N-A-C. It helps to decrease the severity and frequency of coughing attacks and improves the overall lung functions by increasing glutathione, which is major antioxidants in your body and thinning the bronchial mucus. It really helps to thin the phlegm, right? So it's easier to expectorate it, easier to bring it up. Because it's an infection in your body, you want to bring in echinacea herbal tincture, and really look out for the highest quality here. We have different kinds of echinacea purpurea, perfoliatum, and all of that. Even if you have all of them, all these different kinds together, that would be actually the highest quality. So go for one. I know you have to pay a little bit more money, but it's worth it. Echinacea, fantastic here. It has the ability to fight the common cold with its antiviral properties, and it really can meet the cold 58% in its healing process. So go for it. Of course, you want to bring in vitamin C to boost your immune system, and it therefore decreases the severity and duration of any cold or any respiratory affinity and issues which is caused by viruses. I would say 1,000 milligrams of vitamin C to fight off the common cold, but up to 4,000 milligrams per day to get rid of the cold that's already in your system. Of course, that's a dosage plan for adults only. Others were on astragalus and ginseng. Astragalus strengthens the lungs, increases the body's ability to fight infection. It should not be given when you have a sort of acute fever. Ginseng can help, of course, improve the lung function as well, and both are a fantastic combination here. So with all these lifestyle changes and the added natural supplements and the combination with homeopathic remedies, I think you will tackle bronchitis in a very holistic, in a very effective way. Why homeopathic remedies? Because they will target your individual symptomatology and expression of your bronchitis. For example, do you have a dry cough? Do you have a wet cough? Does your cough come with mucus or no mucus at all? Right? That really is the sort of really final point which determines if this treatment plan will work or not. We want to not just bring a generalized treatment protocol, but really target it to your individual expressions. And homeopathic remedies serve as a very reliable and safe treatment with bronchitis. Now, in this video, of course, let's cover the most common prescribed homeopathic remedies which you can purchase in your local health food store as well as online. And of course, if you have questions, contact my practice Medica Nova at health@medicanova.net just to check out your dosage plan, to book your appointment, or contact your local healthcare practitioner. For adults, I would say the dosage plan in the acute state, acute bronchitis, would be 1 tablet every 1 to 2 hours until improvement sets in. Then stop taking further remedies and see how that goes. Sometimes you have to take one remedy, maybe it helps you to bring up the mucus, but then it goes into the dry cough and you follow it up with another remedy. So it's not just one remedy maybe which needs to be selected here. There can be maybe several, but not at the same time. They follow sort of one after each other. And for chronic bronchitis, I really suggest that you contact my practice Medica Nova to set up an appointment, because it needs a little bit more professional help here. The first remedy I would like to share with you, it's called Bryonia alba. It's for bronchitis with dry cough. So that's underlined, dry cough. And there's mucus, a lot of mucus actually. It's very difficult to cough it up, and it may be even a little bit rust colored. You know, can be a bit blood streaked, but rust more, sort of like a little taint of it. But Bryonia alba can also prove very useful for treatments of severe chest pains during coughing, especially if you feel like any movement of your chest makes it worse, or you even, see yourself putting your hand on your chest, because it sort of presses down any movement, sort of when the rib cage sort of raises up when you breathe in or you cough. It's just very painful. Bryonia is a wonderful remedy here. So it's better on taking rest or worse on any movement, any motion at all. Of course, the person is very thirsty, actually wants large quantities of water, because the mouth is dry, the cough is dry. It's like dryness is here really underlined. I used this remedy on an acute COVID patient recently, right? Wonderful, very successful, next to ipecacuanha, which I share with you in a minute as well. Phosphorus 30, if you have a bronchitis cough, which is very hard, dry, but also chest pain. So it's similar to bryonia, but much harder, the cough. And the cough is renewed by laughing, talking. Cold air makes it worse. There can be also excessive heat in the chest, which is another accompanying symptom. Often the patient complains of tightness, heaviness, oppression in the chest, along with these chest pains. And here the mucus, which you expectorate, may be a bit blood-stained, right? So phosphorus is very good. If you have bronchitis, which not just has to do with cough, but excessive mucus, and it's really hard to bring it up. You just try, and you just bring up a little bit, but really it's there, and you even hear sort of a rattling sound in the chest. That means, there is phlegm in there, but it's not coming up with ease. The remedy would be Antimonium tartaricum 30, fantastic here as well. It really helps to empty the bronchial tubes by aiding the expectoration of the mucus, which is present in your bronchial tubes here. So go for Antimonium tartaricum if you can't bring up the phlegm. Spongiatosta 30 is a remedy for bronchitis indicated where there is dryness of air passage and there is no mucus at all. You cough and cough, but there's nothing in there. And you almost cough as if you cough through a sponge, right? There's complete dryness of the air passages, which is very unique. But we have a remedy here. So there's a total absence of any mucus rails in the chest. And of course there can be oppression in the chest, weakness, difficulty breathing, spongiatosta. On the other hand, if you have bronchitis where there's this constant cough with rattling of mucus in the chest and it makes you feel gag, you cough and have this gagging reflex, almost as if you want to vomit or if food comes up. Ipecacuanha, and it's a difficult name, but it's a great remedy for that. Again, I treated patients with acute COVID who had this specific symptom and it worked fantastic. So these remedies are not just indicated for bronchitis only. So ipecacuanha helps to expel the mucus out with the least effort. And an important feature for using this remedy in bronchitis is this vomiting with coughing, right? And it provides some relief for the patient, this gagging reflex. And that's what it is for today. Of course, homeopathy offers many more remedies for bronchitis, from Kali muriaticum, Kali sulfuricum, pulsatilla, belladonna, rustox, and so on. But I really, for the purpose of this video, I want to keep it simple and accessible so it's not too overwhelming for you. And I hope that this video has given you some useful and some inspiring feeling that there can be natural solutions out there. You don't have to always go for the antibiotics. But if you have any questions about the suggested treatment protocols or the homeopathic remedies, how to use them, contact my practice Medica Nova at health@medicanova.net or my website medicanova.net. And in this case, don't forget to have a look at the online academy, where you will find comprehensive certified home study online courses in integrated medicine and health and wellness coaching, and also courses how to use homeopathy, right, for your family, for your loved ones. And next to being a healthcare practitioner, I'm also an adjunct professor at the University of New Mexico, where I teach these courses. So I'm well practiced with students, and I can do the same with you. Take care. Till next time. Much love.